And welcome to the Dr. Bob Show. Do you take good care of your eyes? You should be. How often do you get a routine eye exam, a complete eye exam? What does the eye doctor look for? Do you know that it may be the eye doctor may be the first one to find underlying diabetes, the first one to find underlying high blood pressure, the first one to find problems that go along with autoimmune illnesses, all that in a routine eye exam, as well as looking for a glaucoma, age-related macular degeneration, cataracts. Wow, a lot can be done. And we'll be talking about it on this show. My guest is Dr. Janis Holt. Dr. Holt is a board-certified ophthalmologist, IMD doctor, and she is phenomenal. She'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about early signs of diabetes. Could you have diabetes and not know it? Happens to a lot of people. And pulmonary hypertension. Do you know that the lungs can get high blood pressure that's very different from high blood pressure in the rest of the body and maybe even more dangerous? So a lot of information for you. You'll want to stay tuned. We're talking with Dr. Janis Holt, a board-certified ophthalmologist, that's an IMD, and we're talking about routine eye exam and how important that can be to you and to your eyes. Janis, welcome to the Dr. Bob Show.
Thanks for having me, Dr. Bob. I'm glad to be here.
Should people have a routine eye exam at an early age, or what age should they start?
Well, as you know, a lot of children are screened in a preschool screening. And some children do not pass that preschool screening. And it's really important for parents to follow up on that.
Yeah, you've only got two eyes and you got to take care of them. Do people get scared if their children have an eye problem? Or they usually just need glasses, or they need the advice of a pediatric ophthalmologist? Do they have pediatric eye doctors?
They do, and we have good ones here. Even in Knoxville, we have good folks that can take care of kids. But a lot of times, you just need to see your regular eye doctor or an eye doctor like me. And you need to sort of get to the bottom of why your child failed that preschool screening.
So as we get older, as we get to be an adult, let's say 18, there's no magic age for that. What do you recommend people do when they get to be 18 to 40 during that period of time? How frequent do you see an eye doctor?
At that time, it's really good to see an eye doctor about once every 2 years. Things change in your eye, especially as I found out, and many people do. As you continue on in school, your eyes change, and it's important to have that checked twice every 2 years.
So I remember somebody told me, now, Dr. Bob, when you get to be 40, you're going to find that you need a longer arm. And it was like the very next day. So when somebody comes in the first time, let's say a 25-year-old, they come in for a routine eye exam, what do you look for? What do you do?
Well, really what we check for, the most important thing is a glasses prescription if the patient has some vision complaints, or without glasses if they're not seeing very well.
Do some people not realize, some people really can't see well, but they've acclimated and they don't really think it's worth fixing? What do you usually find at an early age with people that don't focus well?
Well, it's usually a glasses prescription, and you're right. It's happened so slowly, and when we're 20, we have a lot of things to do in our lives, so we don't pay attention to the fact that maybe the leaves on the trees aren't in focus, or maybe the road signs aren't as clear as maybe they should be. We're having a good life.
Yeah, and rainy weather and halo and nighttime vision and all that. There's so many things that the eye doctor has to look for. So when you measure their eyesight and they need glasses, how do you know what type prescription to write? How do you know what they need?
Well, it starts out with really a computerized measurement of the eyes. And that computerized measurement tells us basically where the glasses prescription is. And that's a place to start.
To me, it's unbelievably exciting when somebody is changing your focus point. So what's going on in the eye of the focus point? Are you looking for the lens, or are you looking for behind the lens, the retina? What's the eyeglass looking for?
Well, what's really unusual about this is the eye is a camera, and we're all born with different size eyes. So the glasses prescription essentially is really bringing the image into focus on the retina. My eyes are long, I'm nearsighted. My glasses prescription brings my focus in, puts it in position on the retina. But some people are born with shorter eyes, and their glasses prescription pushes the focus back, and it becomes in focus on the retina. So all we're doing is we're focusing the image on the retina with a glasses prescription.
So when people get their glasses, is it amazing when they say, I didn't realize I couldn't see it? I can say, that must be a wonderful feeling for the eye doctor.
Yeah, it is. Some people are just absolutely amazed. And a common comment is, I didn't know there were individual leaves on the trees.
Oh, isn't that cute to say?
It's wonderful.
So let's look at different parts of the eye. The first part of the eye that you look at when you can touch the eye, what is that called?
That's the cornea.
That's the cornea. What's its purpose?
The cornea is really a lens too. It focuses light just like a normal lens would. So the cornea is the clear focusing window of the eye.
Is it easy to scratch the cornea?
It is easy to scratch the cornea, and a lot of people have that happen to them.
Does it heal fast?
It heals very quickly.
And that's what I think is amazing. What does it actually feel like? Is it a rubbery or a leathery or like a balloon, or is there any description when you touch the eyeball?
Mm-hmm. I think of, and I haven't been asked that before, but I think of the silicone spatulas that we use to clean the cookie batter out of the bowls, and that bendy spatula, that's what the cornea is kind of like.
It's much tougher than I first thought. I thought it would be something that was easily punctured and you would easily get a hole in the eye. So that's the cornea. Later on, the way the cornea is shaped, you have to reshape the cornea in what circumstance?
Well, reshaping the cornea would be done in LASIK surgery.
So that's LASIK surgery, and that reshapes the cornea. So your vision will be better?
So your vision will be better without glasses, or that's what we're trying to do, get rid of the glasses.
So if you work on the cornea, what other parts of the eye are you looking for? Like, what's the iris? What's the pupil? What's the retina? Well, walk me through some of those.
Yeah, in the iris is like an old-fashioned camera that can open up and close down. It's an aperture, and it allows in light. And the iris allows light to pass into the lens. So the lens sits behind the iris, and it's another device that focuses light. And we're all just everything in the eye is trying to put that picture that you're looking at into focus on your retina.
So it looks to me like there's lots of things going on so that you and I can see well.
Yeah, isn't it miraculous?
Yeah, it is miraculous. So if somebody has a wide pupil, what's happening to make it wide? If it looks like the dark part of my eye, the little round part, the pupil part, sometimes it gets pinpoint, sometimes it gets wide. Why is that? It's because the iris?
The iris is opening or closing.
So that makes your pupil very small and pinpoint or very wide. Things can go wrong with the iris?
Things can. The iris can be traumatized.
So if you get inflammation of the iris, iritis, can you see that when you're examining the eyes?
Absolutely.
What's it look like?
Well, what you can see is dilated blood vessels in the iris. You can see where the inflammation that's been in the eye has caused the iris to stick to different parts of the eye. And you can even see the tiny little inflammatory cells floating around inside the eye.
Must be exciting to be able to see all of that. When you look at the lens, what are you looking at the lens for? What do you see in the lens? You see right through it, or it gets cloudy, or what's it like?
Well, for young people, so it's really actually very exciting to see young people because they have these beautiful, clear, crystalline lenses. And they call it a crystalline lens. But as we age, our lens becomes less clear, and then we start calling it a cataract.
So when you see a cataract, do you say, well, you're beginning to get a cataract, or you got a big one and you need to get it fixed? How do you know?
Well, it depends on how unclear the lens is. If it's very cloudy, then that is a serious cataract. And just like the need for glasses, some people don't even know that they have it.
Oh my goodness. So now we've talked about the cornea, you can fix that. We've talked about the iris, we've talked about the lens, you can fix that. Do you find things back in the retina, the back of the eye sometimes?
A lot of times.
And that's what we're going to be talking about when we come back. What do you see when you look at the retina? You're going to be surprised. We can tell if somebody sometimes has high blood pressure, or high cholesterol, or diabetes, or macular degeneration, or detached retina. There's so much going on back in the retina. That's really where the best part of seeing is, I guess. We'll find out. We're talking with Dr. Janis Holt, board-certified ophthalmologist. We've talked about the cornea, we've talked about the iris, we've talked about the lens, we've talked about focal points to see if we need glasses. And now I'm going to try and take us back to the back of the eye where the retina is. What's the purpose of the retina?
The retina is the camera film of the eye.
So that's where when you get a focus back there, it tells you what you're looking at?
That's right.
And sometimes if the focus is not right, you have to use glasses to hit the focus. Okay. What are the cells like in the back of the retina? Are there certain types of cells that are there? What does the retina look like to you?
When I look at the retina is actually translucent, but has a bit of a sheen. One of the neatest things is being able to look at children's eyes, because I always tell children, you have the most beautiful retina. It looks like crushed velvet.
Isn't that great?
It's beautiful.
Yeah, so when the eye doctor says you have beautiful eyes, they would rather you say, well, when you first looked at me, rather than the back of the eye. The retina is where you see the vision part. Are there blood vessels back there?
There are, yeah. There are two different types of circulation in the back of the eye, but the retinal circulation gives us a lot of information.
So you see arteries which are carrying the blood from the heart, and you see veins that are bringing it back through.
Exactly.
What do the arteries look like? Are they huge in the eye? Can you see them pulsate?
Yeah, you really can. They're very tiny, but if you look carefully, you can see the pulsations actually in the veins, not so much the arteries, but the veins. And that's normal to be able to see that.
What does if somebody's got high blood pressure, can you tell that in the eye sometimes? What do the blood vessels look like in high blood pressure?
Well, I tell patients that the arteries at points cross over the veins. And if there's a lot of pressure going through that artery, it actually nicks the vein a little bit. So we call that AV nicking, and it's a sign of high blood pressure.
So right away you can see that. If you see somebody that's got high cholesterol, what do you see in the eye? Do you see it on the eyelids, or can you tell that in the back of the eye?
Well, sometimes we can see a ring around that front window or cornea, and that is a cholesterol deposit, or can be.
So you may be the first one that says, have you ever had your cholesterol checked?
Absolutely.
What do you see with diabetes? Can you see different things with diabetes?
Yeah, in diabetes, you tend to see where the arteries become leaky, and they leak little bits of blood, or little bits of fluid or protein.
When you say little bits of blood, does that mean a little speck, or things fill up?
It can fill up in severe bleeding from diabetes.
But usually you see little micro hemorrhages. Mm-hmm. Is that correct with diabetes?
Yeah.
So can you tell how bad the diabetes is by looking at the back of the retina?
You can, and what I tell patients is I look at your eye because I can see what we also want to know about your kidneys and the tips of your fingers and toes in diabetes, and even in your brain and around your heart. All of these things are little vessels, but I have a window to look at them.
And I think that's the great thing, you know, you say, well, I wonder what my blood vessels are like in my toes. Well, let me look in your eyes, because they're going to be similar in that way.
Yeah.
I think that's just fascinating. I want to jump to the retina. Is the retina on the front part of the eye or the back part? Excuse me, the macula.
Oh, the macula.
Is that on the front part of the eye or the back part of the retina?
the back part of the retina. In other words, if the retina lines the inside of the eye, the macula is right dead center, and it's your finest focus.
So what is the purpose of the macula? What part of the vision? Is it the total vision, or is it the central vision, or peripheral vision?
It's the very central vision.
So if you've got trouble with the macula, I can't really see what I'm looking at real good, but you've got peripheral vision?
Yeah.
What's macular degeneration? What does the macula look like? How's it different?
The macula has the highest concentration of the tiny cells that help to contribute to vision. And so it is the most very delicate and specified portion of the retina, and of the eye, actually.
When it begins to degenerate, and we call it age-related macular degeneration. Last time I went to the eye doctor, he says, you're getting a little age-related macular degeneration. So what does that look like? How can you tell if it's degenerating?
Well, what we see in the back of the eye, and many people have seen, I guess I'll back up a little bit. When the camera flashes and you see that red reflex, that's really a red flash from the retina. Oh. And that red, the macula has even a deeper red. But when it degenerates, that red pigment can actually move a little bit, and you can get little deposits in it that we call drusen.
So drusen are little deposits that you get as macular degeneration starts or gets more involved?
It can be either way. Drusen can be the very start. You may just have drusen and you never get macular degeneration. But it can be something that occurs and changes. The drusen may change as macular degeneration advances.
So with macular degeneration, what's the difference in the dry and the wet form? I've heard there's both.
Yeah, I tell patients, the dry form's usually milder and it's dry. It doesn't leak or bleed. The wet form is often more dangerous or more costly to your vision, and it does leak and bleed.
So is that the reason it's worse, the wet type? Let me back up just a little bit. More frequently to have the dry or the wet?
More dry.
So 90% of the time is dry, but the wet part is the one that we worry about. Can you change from the dry to the wet?
Yeah, absolutely.
And so what does the person look for? What signs do they need to say, hey, I think something's going wrong with my eye again?
Yeah.
What do they look for?
Well, if you don't know you have macular degeneration and it's becoming the wet kind, what people tend to see is, I now have a little blind spot right in the center of my vision. That's not normal, or it's a blur. Some people say, the straight lines on that wall, that beam there, that's no longer straight. It has a bend in it, and that's just not normal, and it can indicate that there's fluid leaking in the wet type of macular degeneration.
Can that be treated?
Absolutely.
And you treat that how, basically? With medications, with injections? What do you do?
Frequently, retina specialists treat that with injections, and that helps to dry up that fluid, and the vision can return to more of a normal state, or at least they can keep it stabilized.
So we've talked about diabetes, we've talked about high blood pressure, we've talked about the retina. Tell me about glaucoma and the optic disc. What's an optic disc?
The optic disc is the very ending of the optic nerve, where it joins, where the optic nerve, the brain has a cable that connects to the eye, and that cable plugs into the eye.
That's a good way to describe it.
Yeah, the cable plugs into the eye, and right where the cable plugs in, that's the disc of the optic nerve.
So what happens? That disc, how can it be damaged or make it where your vision is lost?
Yeah, most commonly that can be damaged in glaucoma.
So what's glaucoma?
I tell patients glaucoma is a condition. Usually you have high eye pressure, and the eye pressure stretches out that optic disc. But when it stretches the optic disc, it slowly constricts your field of vision.
And so it can be a cause of no symptoms, sort of silent blindness, painless blindness, and you can find that on the routine eye exam?
Absolutely.
So you can find about everything, it looks to me. The only thing I'm going to leave out, because we don't have time, is retinal detachment. Is that common? What are the basic symptoms? Won't leave it out.
Yeah, basic symptoms of retinal detachment. The patient often has a lot of flashes of light in their vision.
Like
yeah,
that?
like lightning strikes, like
Yeah.
a lightning storm.
And how about floaters?
Lots of floaters. And I tell patients it's critical, even if you have flashes and floaters, you have to look out for any change in your peripheral vision. We see all the way around, but if something is impinging on my peripheral vision, I need to worry about whether my retina is becoming detached.
Is that an emergency?
It is.
And so that's, if you've got lots of flashes and your peripheral vision is going, you get in to see that doctor, that eye doctor, if you have to go drive to the office and wait at that front desk.
Absolutely.
Janis Holt, you're a great teacher. I've learned more in this interview than I possibly could have imagined. I want to thank you for coming to the Dr. Bob Show and teaching us about the eye and the importance of that routine eye exam.
Thanks so much for having me. It's been fun.
It has been fun, and I enjoy the passion that Dr. Holt has as she's talking about the eye. Now you're going to want to stay tuned. We're going to be talking about early signs of diabetes. What are the symptoms? Could you have it, not know it? And pulmonary hypertension, high blood pressure in the lungs. It's very different than high blood pressure in the rest of the body. We'll learn about what that is, what the symptoms are, and what we can do about it. A lot of information for you. I want to thank Dr. Janis Holt. Wonderful discussion on routine eye exam and all the things that the eye doctor can find. Now, question from you, the viewer, that I think will be important to your health. First question, Dr. Bob, what are the early signs of diabetes? Wonderful question. A lot of people can be getting diabetes, especially type 2 diabetes, and not really know it. But let's look at the early symptoms. Number one, we call it the 3 Ps, polyuria, polydipsia, polyphagia. Well, what do those things mean? Well, the blood sugar goes high. When the blood sugar goes high, it's excreted through the urine. When that happens, water is pulled out of the kidney into the bladder, and so we get a full bladder quickly. So we urinate frequently with large volumes. When we do that, we get dehydrated, we get thirsty. So we drink a lot of water. So we have polyuria, polydipsia is thirsty all the time. And even though the blood sugar is high, it's not being utilized because of insulin resistance or not enough insulin. And so we begin to eat a lot. We can lose weight or we can gain weight, but we wake up frequently to go to the bathroom at nighttime to urinate. And during the day, we find that our bladder fills more and more frequently. And then we get tired and we get fatigued, and then we don't feel good. And sometimes the brain becomes foggy. And if it gets too bad, then we get problems of what we call ketoacidosis, and that's where somebody is, the body becomes more acidic, and we try and blow off the acid, and we do that by over breathing. So if you're drinking a lot of water, if you're urinating frequently and you're eating all the time, all those 3 things together, think of diabetes, get your blood sugar checked. Question number 2, Dr. Bob, I have a family history of pulmonary hypertension. What is that? Well, pulmonary hypertension, that means lung, high blood pressure. There's a primary pulmonary hypertension where it's hereditary and it's passed down from family to family. The normal blood pressure and the lung blood pressure are different. The lung blood pressure is about 1/6, and so it may be a blood pressure of 120 divided by 6, so it may be 20 or 30. So it's low, but if the blood vessels that go to the lungs become thick and become not as elastic, then we get lung high blood pressure, pulmonary hypertension. When that happens, the blood vessels get smaller and smaller. The heart has to work harder to get the blood through the lungs, and we get right-sided heart hypertrophy. It gets big at first and then it dilates out. And then we start getting short of breath when we shouldn't be, when we're out for a walk, when we have a gentle incline. So we get short of breath, we get fatigued easy, and we may get blue lips. We may get where there's just not enough oxygen going. There are that's the primary kind. There are secondary causes. Medications, some diet pills caused pulmonary hypertension. There are connective tissue disease that can cause that. There are some cardiac shunts where we have ventricular septal defect or atrial septal defect, where too much blood ends up going to the right side of the heart, causing pulmonary hypertension. So if you're having shortness of breath and blueness in your fingers, talk to your doctor about it. He'll look for pulmonary hypertension. It's all the time that we have. Remember those 4 things that we like. Number 1, exercise. Get those tennis shoes out. Be exercising 30 minutes and do it 5, 6, 7 times a week. Walk briskly. Have a good time. Get a friend to exercise with you. Eat properly. Eat less fried fatty foods. More fruits, more vegetables, more antioxidants. Enjoy eating, but don't make it less volume. You know what you should eat. You know how to keep your body weight normal. 7.5 hours sleep, you'll be rested, you'll feel so much good. If you're not sleeping well, if you can't get to sleep, or if you wake up and can't go back to sleep, then you may have to seek professional help. Sleeping is a real art. And most of all, what is it we like? It's that laughter in your life. Laugh a lot, giggle a lot, have fun, and you'll stay